Hello, my name is Tammy Stoneman. I'm a fourth year student at Algoma University in the BSW program. I am finishing my placement hours at For a Safer Space, FASS. Today's topic is going to be suicide risk assessment and intervention. But before we get started, I would like to acknowledge the Robinson Huron Treaty, and the land on which we are gathered is the traditional territory of Anishinaabe nations. This is important because we're all treaty people. Okay, so the agenda. We're going to look at what is suicide. Is suicide preventable? Systemic perspectives on suicide, people at risk factors and causes of suicide. What do social workers do to raise awareness? Suicide prevention treatment video, and my thoughts. Then the last slide, thank you, the end. I'm going to apologize up front for not having my camera on, but I'm having some technical difficulties with that. So we'll just move forward. What is suicide? Well, CAMH defines suicide is the act of intentionally causing one's own death, often related to complex stressors and health issues, leading individuals to experience hopelessness and despair. Suicide is considered a preventable public health problem. I'd like to point out a few things. In Canada, 11 people die every day due to suicide. 1/3 of suicides are between the ages of 45 and 59. It is the second leading cause of death for young and young adults between the ages of 15 and 35. Suicide rates are 3 times higher for men compared to women. Suicide attempts are 3 times more likely for Canadian-born residents compared to immigrants. Systemic perspectives on suicide. According to Cherry and Efford, 2014, prevention influences intervention, intervention influences postvention, and postvention influence prevention. It's cyclical. And it also works on a micro and macro level. The micro level is the individual and the care they receive through social workers. The macro level is the knowledge, research, and education that is put out for the public and learned by social workers. People at risk of suicide may show things to look for. Show a sudden change in mood or behavior. Show a sense of hopelessness and helplessness. Express the wish to die or end their life. Increase substance use. Withdraw from people and activities that they previously enjoyed. Experience changes in sleep patterns. Have decreased appetites. Give away prized possessions or make preparations for death. For example, creating a will at 15. Risk factors or causes of suicide. People may have a serious mental health and or addictions problem. They may have suffered a recent loss, a death of a loved one, a job loss. They may have a family history of suicide, may have made previous attempts, have a serious physical illness, have an impulsive personality, lack supports from family or friends, have access to weapons, medications, or other lethal means of suicides. Now, I'm going to go back to have a serious physical illness because before I started social work, I was a nurse for 20 years. And I've experienced people with Lou Gehrig's disease expressing the wish to die because they're going to die of this illness. There is no cure. So social workers may come across this, especially in hospital settings or in nursing homes. Okay, so we're just going to watch a short suicide video looking at prevention and treatment.
I don't want to live anymore.
I can't stop thinking about suicide. I've thought about it for years.
I've made 3 suicide attempts, and I don't know if I'll be safe tonight.
I just drink enough so I can stop thinking about killing myself. I hate thinking about it.
These are the voices of suicide. They are the voices of people in despair who don't know what to do about their thoughts and who might do something dangerous. We know how to help people with these thoughts, and we know how to help people turn away from dangerous behaviors and towards something that can provide them with the help and hope they need. There are several evidence-based treatments that help prevent suicide attempts. This means that they have been proven to be more effective than other kinds of therapies in reducing suicide attempts in people who need this help. 3 of the most effective are dialectical behavioral therapy, or DBT, cognitive therapy for suicide prevention, or CTSP, and brief cognitive behavioral therapy, or BCBT. The proof that these treatments reduce the chances for suicide is very strong. DBT, CTSP, and BCBT share some common goals and activities. Safety. The beginning of treatment starts simply by figuring out what people can do to manage what they are thinking and feeling during a crisis. Sometimes this is called a safety plan or a crisis response plan. Each safety plan is unique and individualized. Managing hard feelings. Sometimes people feel powerful, negative emotions, and they don't know how to manage or cope with how intensely bad they feel, which is when thoughts of suicide emerge or grow stronger. Treatments help people learn ways to care for themselves when the thoughts and feelings are the worst. This can be done using relaxation, mindfulness, or distraction techniques. These are skills a person learns during a time when they are not in distress, so that they can effectively use these skills when they are feeling really overwhelmed. Changing what you do. People often develop their own ways of coping to try to manage how badly they feel. Drinking or using drugs, isolating, avoiding work, eating poorly, or generally not taking care of themselves can all be examples of things people do when they are feeling bad, but that we know don't work well. The good news is that new skills can be taught and acquired to give people skills to better manage their feelings. Changing what you think. People who experience thoughts of suicide often become hopeless that things will never change. Sometimes these thoughts can be triggered by something simple, but spiral out of control. These 3 treatments all focus on practicing, paying attention to, and changing these types of thoughts. Staying well. After people begin to feel more hopeful and develop some new skills to manage these thoughts, they practice ways to effectively and quickly respond if suicidal thoughts and behaviors return in the future. Thinking about suicide is scary, and it's hard to know what to do. But those thoughts and behaviors can be targeted, treated, and changed. DBT, CTSP, and BCBT are each effective treatments that focus directly on suicidal thoughts and behavior. They can help people to improve and find hope.
Okay, this video points out some treatment prevention. So the treatment in the video is much the same in Canada. The acronyms are a little different. Help, ask, listen, tell. So my thoughts. Suicide is preventable with public health initiatives and mental health campaigns. Social workers need to work in collaboration with others in the community to get information and resources out through mental health campaigns and initiatives. Social workers fight to raise awareness and play an intricate role in counseling people who attempted suicide, people who tell and want help. Social workers need to apply interventions to secure the person's safety. Safety above all else. People with mental illness and addictions are at high risk because they're using addictions as a coping mechanism, and it makes it twice as hard for them to turn things around. Social workers need to know the signs, causes, emotional toll on clients, the shame involved, guilt, and their role in helping people with mental health disorders or addiction problems. Many people who think about suicide or have suicidal ideations feel shame, feel guilt, and it makes it worse. They become more helpless. Social workers need to treat suicide attempts or suicide ideations seriously. Social workers need to call the police if someone tells them they are going to commit suicide, especially if they leave your care and are convinced they want to die. Social workers need to be aware of all the resources available in your area to help people before they succeed at suicide. I found this National Suicide Prevention Lifeline number. I want to put it up on the screen for anybody watching this. If you need help, there are resources in your own community, but talking to somebody can help you find resources to ensure that you are safe and to get you the treatment that you need. So call a prevention hotline or lifeline. Thank you. The end. Again, my name is Tammy Stillman, a fourth-year student at Algoma University, working with For a Safer Space, FASS, finishing my placement hours for the BSW program. Thank you for watching and listening to this presentation.